A woman getting sick in the Pentagon parking lot. That's all it takes to have the building partially locked down and hazmat crews rush to the scene. The incident, of course, sparking fears of another Ebola case in America after the woman admitted to recently visiting West Africa. Several policemen who were on the ground were also isolated. Though the woman has been given the all-clear, RT's Anastasia Churkina now reports on the panic that is quickly spreading faster than the virus.
Ebola has been scaring the living soul out of you, me, and everyone we know. The internet is abuzz with ideas for alleged cures and homemade remedies to tame the wild beast. But why wait for a vaccine when a cinnamon stick can come to the rescue? Claims are going viral that Ebola cannot survive in the presence of cinnamon bark. If that doesn't help, there are offers of supplements with nanoparticles of silver, or one can always turn to a nice relaxing bubble bath with not just any water, but the blessed sea salt kind. If you don't think bathing in and drinking blessed sea salt water is your cup of tea, there are always a bunch of herbs on offer, like astragalus or Garcinia cola, to stock up on. Now, also, everyone's old friend, vitamin C, is promoted by others as anti-Ebola remedy #1. Apparently, it's only a question of consuming as much as possible, with Twitter users admitting to popping 6 vitamin C pills a day to avoid Ebola. Now, this Twitter user's mom has prepared herself for the worst with hydrogen peroxide, garlic cloves, and an entire gallon of no-name Chianti. Others swear by a concoction of honey, lemon juice, whiskey, some more garlic, and chili flakes. Sounds very, very tasty. Now, some bloggers are calling on the world to stock up on food and supplies in case entire cities are quarantined, and swear that now is the time to learn to isolate an infected family member before it's too late. Panic galore. Now, even the Food and Drug Administration in the US has had to step in and issue warning letters to manufacturers to chill out and stop the madness. But with people's stress level over Ebola obviously stretched to the limit, reason seems to have left the building. A cinnamon stick in hand and a garlic clove around its neck. Anastasia Churkina, RT, Moscow.
Of course, it's always good to be prepared, but before you stock up on cinnamon, garlic, and boxes full of wine, you should ask yourself some very simple questions. For example, have you had contact with the skin or bodily fluids of an infected person? Have you touched contaminated needles, surfaces, or infected animals? If the answer is no, then you don't have Ebola. An official from the Arizona Health Department says the media is pumping out confusing and conflicting information.
We're really trying to make sure that we're sticking with the facts. And so I think that the media is really a useful tool in getting information out, one, to the general public, and just letting them know that this isn't something, unless you're actually traveling in contact with a sick person, there's not a lot of risk to you. But then you see in the media that people are responding with, the big moon suits with the hoods. That's a conflicting message. And so that's a little bit harder for public health to deal with. But when you're trying to tell the healthcare facilities, no, all you need are goggles, gloves, masks, and a gown, they're like, well, how is that true? I see the people on the planes and transporting patients in the full-on moon suits.
Now, the World Health Organization has admitted its handling of the outbreak has been less than ideal. The WHO admitting that the initial response was slow and disorganized. In a memo obtained by the AP agency, the organization blames its own staff, calling them incompetent for letting the disease spread beyond Africa. You can read on more exactly what was said at RT.com.